So we look at another infection-related issue this evening, and this is what is known as a chronic pyogenic infection. Chronic pyogenic infection. So for the chronic pyogenic infection, of course, when you say something is chronic, it has been there for a very long time. And once you are saying pyogenic, you just have to do with accumulation of pores, So chronic pyogenic infection is just caused by pus forming bacteria, especially when you are dealing with other Staphylococcus aureus, Streptococcus, gram negative. So when it becomes chronic, we just simply say that's the pyogenic infection generally is by these guys. So when we're saying it is chronic, we're just trying to say it has been there for a very long time, weeks to months, often due to incomplete eradication. You have not treated it nice and all of that. Poor vascularity, presence of foreign materials, So pathophysiology, first of all, there's an infection and the bacteria comes in, it keeps replicating, making other copies of itself, Then tissues are actually dying, even before the pus formation. So when you don't treat it very well, this is when it now becomes an infection that's been there for a very long time, progresses to chronic infection. So features, you're having abscesses, you're having sinus tract, sequestrum formation, involucrum, that's new bone is now forming around the dead bone tissue, and can usually seen in osteomyelitis. It's mostly seen in osteomyelitis. Like these last features were osteomyelitis, right? But it could also occur in any tissue. So common sites can occur in long bones, can occur in the spine, can occur after surgery, none of that. So you're having a lot of pain, a lot of swelling, and pus. The pus that's accumulated for a very long time is discharging. Low-grade fever, and you're feeling like you're just unwell. Then if it occurs in bones, the bones can get weak and there's a threat for it fracturing. Also deformity. So you diagnose by trying to measure all those inflammatory markers, white blood cell count, the microbiology. You are trying to culture and identify the microorganism causing the issue. They do imagings like all those X-ray, MRIs, and CT scans.